Joining us now, world-renowned cardiologist and epidemiologist, as well as the chief scientific officer at the wellness company, our good friend, Dr. Peter McCullough. Doctor, good to have you back on.
Thank you.
All right, the fight is on. Bobby Kennedy has been nominated for the HHS Secretary's job, and Big Pharma, man, they're putting their money into trying to block it. Tell us why that is.
Big Pharma and Big Food, John, both have stated opposition to Robert F. Kennedy, who presents really a threat to what's developed over time as really corruption and collusion with the U.S. government. Take Big Pharma. And, all of the interrelationships between the CDC, the NIH, and FDA, vaccines, marketing of vaccines, purchasing of vaccines, expensive drugs, direct-to-consumer advertising, all of this has now been threatened by the, prior statements of Robert F. Kennedy that say, wait a minute, we can't have this level of corruption. We can't have quid pro quo. Direct-to-consumer advertising, which is deceptive. And on the big food side, he said, listen, we've got to get harmful substances out of the U.S. food supply. That means reconfiguration of many food products.
Yeah, and those are all big threats to big industry. There's no doubt about it. Now, you mentioned the alphabet soup. FDA former Commissioner Scott Gottlieb says he's going to be working it super hard. Tell us what he's been talking about and the threats he's been making.
Scott Gottlieb, who's a former FDA commissioner, is one of the younger commissioners. He's done what 9 out of the 10 last FDA commissioners did. They left their government job after currying favor for Big Pharma, and then they joined the big pharmaceutical industry itself. In this case, Gottlieb joins the board of Pfizer. So what has he done over the last 4 years? He's been on CNBC advising Americans to take Pfizer vaccines. There's no more clear conflict of interest of this. Yeah, now Gottlieb was on last week with Joe Kernan and Becky Quick, saying that Robert F. Kennedy is going to be dangerous for America, that he'll cost American lives, and that Gottlieb himself is going to lobby senators to vote against RFK's being confirmed as HHS Secretary.
Amazing, and amazing to see the long reach of Big Pharma all throughout this country. You mentioned the revolving door. I think another area that is often troubling for Americans is the lack of transparency we've gotten, particularly when it's about the COVID-19 vaccine and maybe other vaccines as well. You have some great ideas for breaking through that wall and giving Americans transparency. Is the next couple of years that moment in history where we might actually make a breakthrough?
It certainly is, and Robert F. Kennedy has made a big statement on the need for data transparency. For instance, the CDC holds the vaccine administration records and the National Death Index. We need to merge those two, see if there's a mortality signal, where it is, who potentially was in the crosshairs with that. We need transparency on the dossiers that the companies kept. Pfizer wanted to keep their dossier away from Americans for 55 years. It's come out in dribbles. The Daily Clout and Naomi Wolf has tried to assemble it the best she can, but we haven't seen the dossier for Moderna, Janssen, or Novavax. We need complete data transparency. And the last thing that people have said that we don't need is direct-to-consumer advertising. Now there's efforts in New Zealand, the only other country that does this, and hopefully in America, to get rid of this expensive practice, lower the price of drugs, and stop confusing Americans.
Yeah, what a great idea. It's about time we got there. I want to ask a little bit, this comes up a lot when I'm out in the public. Do you believe that artificial sweeteners, dyes, and chemicals that's been put in our food are playing a role in a lot of the degenerative health conditions that we're seeing spread across America?
There's broad agreement that trans fats are. That's partially hydrogenated soybean, seed, and vegetable oils. There's broad agreement there. The AHA, World Health Organization, so many organizations want it out of the food supply. Even the FDA says it does, but they haven't gotten over the finish line because of the power of the big food lobby. RFK has a great chance now of getting that over the finish line. And next up, I think, will probably be food dyes and artificial sweeteners. There's a little less agreement from the academic community.
Yeah, big things to be watching on the horizon. Dr. McCullough, you've done so much to revolutionize medicine. The telehealth work that you're doing is amazing. The emergency medical kits you've done are first class, and they really change people's lives. Now we can be prepared in advance, not wait till crisis strikes. We can't thank you enough for all that you do for us.
Thank you.